What are some of the signs of early menopause?
So, someone who has early menopause, so again, menopause meaning you've gone the full 12 months, no periods. So, generally, we think of someone before the age of 40. If that's when they hit menopause, then they're in early menopause. And that really matters because we need our body to continue to make estrogen. Estrogen protects our bones, our brains, and our heart. So if we're going that extra 10 plus years without estrogen, that really is setting people up to have osteoporosis, brain dysfunction like dementia, heart disease, and especially in the past couple of decades where everyone has been terrified of prescribing and using hormones, that just means they've been going for that much longer without the protection of estrogen. Most commonly, reasons for early menopause could be genetic. So I don't know about your mom's history, but genetic causes can be one reason. Autoimmune conditions, if they're attacking the ovaries, that can be another cause. A surgery where you have your ovaries removed, that can be another cause. Or if you had certain medications like chemotherapy, chromosomal conditions can cause early menopause. So there's a lot of reasons why, and it can be more than one. So, and then there's just idiopathic where we actually have no idea why it happens.
That's really interesting. You said that, losing your estrogen any amount of time earlier than what's normal, having those long-lasting effects like dementia or osteoporosis. To that point, if someone experiences menopause, early menopause, there's menopause in general, even years later, say 10 years after, 20 years after, is hormone replacement therapy something you could do even years later?
So, if someone's in menopause, then one could argue you don't really have to check their levels. There's different schools of thought in terms of testing in the first place, especially if you're planning on putting someone on hormone replacement. The way I practice, I do test people's hormone levels because I want to know where they're starting and also like how they're doing. But I know sometimes others don't even bother and they go solely based on symptoms. As far as starting hormones years later, we know the safest time is to start within 10 years of menopause. After that time, there could be risks of like heart disease clots. That's not to say that you can't start it later. You just want to make sure that you're choosing the right candidate. And some people will want to make sure that if you are starting it later, like let's say that average 51, now they're 65 and they want to go on it, they're not going to get as much benefit anymore. And some may say, let's have you make sure you get like a cardiac clearance or a clearance from your primary care. Again, not everyone might do that, but it is a little bit higher risk to start later. And again, you're not getting all the protective benefits as if you had started earlier.
That's an excellent point. For the healthiest outcome, not to go 10 years past when menopause started for the hormone replacement. There was another person, and she had, seen her doctor, and she looked at the chart and it had talked about vaginal atrophy. Is that another result of
Oh,
menopause that can
yes,
happen?
absolutely. That's going to hit like 50, 70% of women, honestly. And that can definitely start before menopause. I mean, I would see it a lot in much younger women if they were on birth control pills, which lowers their body's natural hormone levels, or if they were postpartum, but you certainly see it a lot during perimenopause. And the reason is, the hormones really work on all of the cells throughout our whole body. So that would include the vagina. So estrogen, testosterone are both very essential for the health of the vaginal tissue. And when you have decreased amounts of those hormones circulating in the body, you're going to get less of those hormones reaching that tissue. So the tissue just becomes less pliable, more friable. It's almost like sandpapery. So it just can be excruciating during intercourse or even wiping when you go to the bathroom. You're just constantly aware of the discomfort. And of course, it's not supposed to be that way. And so even throughout this the past couple decades that I referenced, where there was this fear surrounding hormone replacement therapy, there had still been uh, use of vaginal estrogen therapy. Still some confusion regarding that, which I'm happy to get into. That's a whole topic. And it's a hot debate currently, thankfully, but that is different than hormone replacement because it only acts locally on that tissue.